You wonder why the Democrats jammed through that ill-conceived health care bill. Because they knew that ultimately it would cost them the Congress, and it will. The chances of the Senate flipping to the Republicans is very, very strong. The Republicans will hold on to the House. They'll still have the White House, though, till Obama's finished, and they might well elect a president. You don't know. But it was as if we can get this thing into the American experience, and it'll be like an amoeba that just spread out, or like a fungus that's on you can't get rid of. And they knew that if they could socialize that part of our economy, 1/6 of the economy, they would be a long way toward the goal of having central control of a great deal of what Americans do. Well, Obama made lies when he was selling it. He said, well, if you like your health care, you can keep it. If you like your doctor, you can keep him. If you have health care, it'll be cheaper for you. And so instead, this thing has created so many problems, much of it's been put on hold. And again, he didn't have congressional authorization to do it, but he did it unilaterally, ignoring what's called the rule of law. But whether you like it or not, that wretched piece of legislation is the law of the land. It passed the Congress without any Republican support at all, strictly a Democrat bill, and Obama signed it into law. But as Laurie Johnson sat down with one person who knows Obamacare inside and out, and she got some tips on how you might be able to avoid the pitfalls.
Obamacare has been around in one form or another for over 3 years now, and most Americans still don't know what it means for them and their families. That included much of Congress.
But we have to pass the bill so that you can find out what is in it.
Betsy McCoy, however, read it and understands it. In her new book, Beating Obamacare 2014, she spells out how to brace ourselves for what's ahead. Over half of Obamacare is paid for with cuts to Medicare, mostly what Medicare pays hospitals. One result, hospitals will cut back on nurses.
So no matter what age you are, if you're going into the hospital, be aware you're going to get a lower standard of care. And when you press that button for help, you're going to have to wait longer.
So if you know you're entering the hospital, you could hire a private duty nurse, at least for the first night or two.
All the doctors, especially surgeons, but generally all doctors keep a list of private duty nurses they prefer. The hospital also has a list of agencies with which they deal, so the nurses they call will be very familiar with the routine of that hospital.
Those Medicare cuts will also hit individual doctors, as their reimbursements for treating their Medicare patients will drop. So plan ahead.
If you're in your mid-50s, late 50s, early 60s, line up your doctors now, a cardiologist and an internist, even if you're healthy. Because if you don't, when you turn 65 and go on Medicare, you won't be able to find a doctor willing to take you on as a new patient.
We all confide things to our doctor that we wouldn't tell anyone else. But under Obamacare, doctors enter all that private information in a computer. And recent headlines highlight the problem that private information on the web can fall into the wrong hands.
You ought to talk to your doctor about keeping 2 sets of books, so that there are certain things that just stay in that office. That's the way it always used to be when doctors kept paper records. And just give your doctor a heads up. Your doctor will appreciate it, because doctors take the Hippocratic Oath, and that oath means keeping your confidences private.
This year, an estimated 25 million people will lose the health insurance they have through work. Employers won't be able to afford the new small group plans that contain all of the benefits the government requires. So don't be caught off guard.
Go talk to your Human Resources Division now, or your boss, or if you're just part of a small group, talk among yourselves and find out whether this is going to happen. There's nothing worse than being clobbered by surprise.
If your company insurance goes away, you'll need to budget more for health care.
Be aware that if you are forced to go to the exchange, you're going to pay much, much more and get less in return.
It might be cheaper to choose coverage that doesn't meet the government requirements and pay the penalty.
Talk to an insurance agent and see whether that's a viable alternative for you. For example, if you try to get high deductible insurance or a plan that doesn't meet the 10 essential benefits, but has everything you want.
Although Obamacare is the law of the land, McCoy says it's not too late for a motivated Congress to repeal it.
Then in the future, when we have better people in Congress, replace it with targeted help for the uninsured. And you know what that will do? It will leave the rest of us alone.
And finally, McCoy says people of faith need to fight back.
This law is part of a much broader, and I'm sad to say it, a broader assault on our ability to worship. And not just worship in church, but more importantly, to practice our faith in our everyday lives. There's a big assault on religion. And I think we have to take a stand at this point and say, if you like your God, you can keep your God.
Man, she is something else, Betsy McCoy. And you had a chance to meet with her?
I did, and she is so knowledgeable, and she really wants everyone to know that the biggest punch is going to come to the seniors. $716 billion is going to be taken out of Medicare and redistributed into entitlements and other programs under Obamacare. Now that shakes down to about $1,500 less being spent per senior, but there are some things that seniors can do to mitigate the damage.
What can they do?
Well, for one thing, we should be aware of the fact that Section 3000A gives bonus points to hospitals who spend the least amount on seniors, not any patient, just seniors. And they measure that by when you're in the hospital and 30 days after your hospital stay. So let's say you go into the hospital and have a knee repair. Well, they might tell you that you don't need to come back for rehab. But you need to do your own research and look into it for yourself and push that much harder for care that you need, that you believe that you need. And it also is going on not just in the hospitals, but in doctors' offices as well. Medicare reimbursements are really going to be going down.
You're telling me that they throw an elderly person out of the hospital early, they get a bonus from the government?
They do, and they also get penalized for keeping them in too long.
Unbelievable.
It is, and then this is also going on in the doctor's offices as well. Medicare reimbursements are just plummeting. They're low already, but let's say that you're a senior and you have back pain. Well, there are lots of procedures doctors can do in the office to keep you from having back surgery, but Medicare is now going to be reimbursing 60% less, not 60% less. So doctors aren't going to want to spend the time if they're not going to be getting paid hardly anything for it. So again, you need to look into what's best for you and push that much harder for the care that you believe you need.
Betsy, think the game plan was? I mean, they are destroying the rights of people and the health of our nation. And for what? It's a socialist agenda to take over? What does she think?
Well, she thinks that most people didn't know what was in the law, and that it's a big surprise even
That's
to
what the
Congress.
Speaker of the House said,
Of course. And it's definitely a surprise to people who voted for people who passed it. And it's going to be interesting to see what happens in the midterm elections, because we saw 6 million people lose their individual health care last year. This year, it's going to be 4 times that amount. People losing their health care at work, people who have those small group plans, and they're going to be getting their notices probably in the fall, right before the election. And people need to be careful, because this might affect you if you work for a medium-sized company and you might be getting that notice in the mail. So people need to start thinking about that now and reworking their budget, because if you lose your health care at work, you're going to be spending more money for it. So you might want to rethink that vacation, might want to rethink that purchase coming up, because according to the Kaiser Foundation, people who get health care at work spend $990 a year pre-tax, but in the exchange, it's going to be thousands of dollars after tax.
That's horrible.
The average deductible for people who get insurance from work now is about $1,100 a year. It's going to be many times that more in the exchanges.
What you're saying is a nightmare. It's going to be a body blow to the poor in America, a body blow to the elderly. This is incredible. I mean, what these people in Washington have done to us is beyond belief.
Well, if more voters feel that way when they start getting their notices, perhaps the election will go differently than the presidential election went before. That's before we learned all the bad things of Obamacare and we only knew the good things, that your kids can stay on your policy until they're 26.
Yeah, he lied. But it's just, It just is simply ghastly to even contemplate what they're doing.